Hello everybody, thank you for joining me today, and in today's video we're going to be looking at how to approach anatomy at medical school. So at medical school, anatomy is something that is extremely important, and you will get quite a lot of teaching from the anatomy team during your pre-clinical years, so during years 1 and years 2, and then from years 3 all the way to years 5 you'll be expected to refresh and keep your own anatomy knowledge up to date as you move throughout the clinical years, because you won't necessarily have as many anatomy sessions. And reflecting upon my own experience, from years 4 onwards we didn't have any anatomy sessions, so I think anatomy is something that's really important that you get to grips with quite early on, and hopefully after watching today's video it will help you feel a little bit more confident in approaching anatomy. Okay? So the Medicine Guide is a YouTube channel which offers free online videos to help support medical students all throughout their journey at medical school. So I've got videos on how to be successful during the pre-clinical years and the clinical years. I've got videos focusing on the high-yield paediatric topics that crop up in medical school final exams. I've got videos on the high-yield obs and gynae topics that crop up in finals, the high-yield cardiology topics that crop up in finals, and the high-yield imaging that crops up in finals. And this video, in conjunction with others, is used to support students when they're tackling anatomy sessions, histology sessions, and also their PBL and CBL learning sessions. So without much further ado, let's get started. So the outline of today's video is as follows. So initially we'll discuss about how anatomy is taught at medical school. So some medical schools prefer using a dissection approach, whereas others prefer a prosection approach, and we'll discuss the differences between the two. Then we'll talk about how anatomy forms part of your assessments whilst you're at medical school, and then I'll be offering some top tips on how to approach your anatomy sessions, as well as recommending resources that you can use for anatomy. So without further ado, let's get started. Now, there are two different methods in which anatomy is taught at medical school. There is a dissection approach, which is a very hands-on approach, or there is prosection. Now, prosection is similar to, I would say, almost like a Blue Peter style of teaching anatomy. So before you begin your anatomy session, the members of the university team that's in charge of running the anatomy suite will have already dissected the cadaver or the organ beforehand. So when you walk into your anatomy session, your clinical tutor will be presenting that dissected cadaver or that dissected organ to you, and they'll be pointing out and identifying key structures that you need to be aware of and offering teaching. So that's the prosection approach, or the Blue Peter style method of teaching anatomy. Now, dissection, like I said, is a very hands-on approach to teaching anatomy. So in dissection, either the clinical tutor or members of your CBL team or PBL team will be given the opportunity to dissect, and then anatomy teaching will follow as well. So dissection is a very hands-on approach, so people who are very keen and eager to dissect will have the opportunity to do so, whereas prosection, like I said, the cadaver or the organ has already been dissected, so the tutor would be presenting key structures to you. So in that sense it is a Blue Peter style of teaching anatomy. Now, there are pros and cons to both dissection and prosection. One thing to be aware of is that if your course is predominantly a dissection course like mine was, there will be certain situations where they have a prosection style of teaching, and again this will vary on the theme of the anatomy session for that particular week. So I would say that roughly about 85% to 95% of my teaching at medical school was via this dissection approach to anatomy, but only 5 to 10% of the time did we have prosection. So it doesn't really make a huge degree of difference, I don't think, but there are pros and cons to both methods of teaching. But the most important thing is that you're able to identify the anatomical structures. Okay, so let's move on to the next part of the video. So anatomy is a key integral part of medicine, and unfortunately anatomy is a double-edged sword in that anything in anatomy can crop up in your written exam papers, and it can also crop up in your OSCEs. At my medical school we have 2 clinical OSCE stations dedicated to just anatomy during the summer exams for years 1 and years 2. And I think it's quite similar across other medical schools that there will be 2 OSCE stations dedicated to anatomy in years 1 and years 2. And one of the key concepts that I reflected on after my year 1 and year 2 exams was that anatomy questions tend to be focused on key principles of anatomy, and one of the key principles of anatomy that they love to examine students on is about nerve palsies. So if you would like to, then please could I invite you to watch my video on nerve palsies, and hopefully that will put you in a better position for your exams. Now I've got some top tips which I've broken down into tips that you can use before, during and after the anatomy session. So the tips that I have before you even walk in to the anatomy suite is to consolidate your knowledge from the previous week's anatomy session. Now, it might sound a little bit silly, but usually the anatomy sessions tend to be linked together. So if you were looking at the mediastinum the week beforehand, it's a good idea just to freshen up on that, because in this week's session where you're focusing on the heart is the key aspect of the mediastinum. So if you're not familiar with what structures are found in the mediastinum or what is the mediastinum, then you might struggle understanding heart anatomy, for example. And also I would say briefly familiarise yourself with this week's anatomy topic. So if you have a quick look at some of the resources that I'll signpost you to in the latter aspect of this video, hopefully when you walk into anatomy you'll be a little bit more familiar with the organ or the structures that you're going to be looking at in the session, and hopefully listening to your anatomical tutor will help to reinforce all of the information that you've been reading in preparation for your anatomy, and hopefully you'll get a little bit more out of it. Now during the anatomy session, it sounds very silly, but it's really important that you actively listen during anatomy. It's very easy to become a passive listener and just to sit down and just write very mundane notes. But what I found really important when I was learning anatomy was that if the clinical tutor asks this question, if you know the answer, then please do share with the group, because in a way teaching other people helps to reinforce your own learning, and also it keeps you actively involved in the session, because anatomy sessions can often be quite long. They can last 1.5 hours up to 2 hours depending on which medical school you go to. So making sure that you're part of discussions in anatomy will help to not only retain your knowledge and reinforce your learning, but it also helps you to remain engaged in what is a very, very long session. And secondly, I would say take rough notes during the session. So don't worry if you can't write all the key features down very neatly. As long as you've got the rough outline of what you need to do, then that's fine, because your anatomy session will essentially build the skeleton of your anatomy notes that you'll probably spend the next week writing nicely. So as long as you've got the key concepts written down on your paper, on your notepad, then that's the most important thing. And secondly, I would recommend getting involved in dissection if you can, if you want to, because in your OSCEs it's most likely that they will ask you to point to key structures that they'll expect you to know, and if you're not familiar with where those structures are, then you'll definitely struggle in the OSCEs. So please make sure that after reading the clinical anatomy textbook, or after looking at the nice plastic anatomical models, that you're able to look at the cadaver and identify those structures, because that's the sort of skill that's going to differentiate the candidates who do well in anatomy OSCEs and differentiate those that unfortunately don't do as well. Okay? And after the anatomy session, I would strongly suggest that you finish writing your anatomy notes before your next anatomy session. So you can write down your notes either in a handwritten form, and I know quite a lot of the medical students in my year enjoyed writing down their notes by hand. Other students liked making posters, and other students preferred using more electronic notes, so using PowerPoint slides or even writing Word documents. From personal experience, I found the PowerPoint slides more useful in terms of making the anatomy notes, because you can find really good label diagrams from Google or from online ebooks, and then you can essentially copy and paste that onto the PowerPoint slide, and you can write your notes on the text next to it. And also you can use animation slides, so you can cover the labels on the diagram, and you can use that as a way of testing yourself and making sure that you're learning. And secondly, I would say that it's really important that you consolidate your knowledge. So use the anatomy models, use Quizlet, so that's an online website that you can use for free, and you can use, and it's almost like a quiz that you set. So you can create this quiz about listing all the key features that cross the diaphragm, for instance, and at what spinal level do they cross the diaphragm. And you can write that as one of the quizzes in your Quizlet, and then also have your answers. So when you click on the quiz function on Quizlet, it will come up with a question, and you'll have to answer that question in your head, and you click another button and it comes up with the answer. So it's a really good way of consolidating your knowledge. And Quizlet, I think you can also download it as an app on your phone. So if you're sitting on the bus on the way to uni, you can just practice those quizzes in your spare time. And also there are some anatomy flashcards I think are really good that you can use to consolidate your knowledge, and especially in the lead up towards your OSCEs. And I've got examples of some anatomy flashcards that I found were quite useful. And finally, mnemonics. So anatomy is quite a detailed element of medicine. Some of the structures are quite difficult to remember the names of, so I would suggest using mnemonics to help you revise. And there are some mnemonics that are more popular than others. For instance, I think nearly all medical students have some mnemonic in mind when they're trying to learn about cranial nerves. So don't be afraid to use mnemonics to help reinforce your own learning. And finally, I would say be familiar with different anatomical views, and I'll explain that. So like I mentioned previously, it's very important that you're familiar with the different anatomical views of all the different organs that you come across in anatomy. So during your anatomy session, you're probably quite familiar with this particular view of the heart. So this is known as the anterior view of the heart. However, unfortunately, neither you nor I can guarantee that you will only be assessed on the anterior view of the heart in both the written exam paper and during an anatomy OSCE station. You might get asked to identify the structures of the heart when the heart is in this view, so the posterior view, or even this view. So this is a more superior view of the heart valves, or potentially even this view. So it's important that when you're making your anatomy notes that you find as many diagrams with different orientations of the particular organ, just so that you become more familiar with the different views, and also that you become a little bit more confident when you're asked to identify different structures, because in your written exam paper and even in your OSCE station, they could present the heart in a range of different views, as you can see on the screen here. So it's really important that as part of your preparation that you become more confident and familiar in tackling this, and I'll give you some hints and tips in the next slide. So I've previously made a video discussing how to be successful in the pre-clinical years at medical school, where I recommended different resources that I use to help with the different aspects of the course. And one of the topics that I discussed was looking at anatomy resources, so this slide is taken from that video. So I really think that the Moore's Clinical Anatomy book is the best book for anatomy. I used it throughout the pre-clinical years and I dipped into it during the clinical years, and I would strongly recommend Moore's Clinical Anatomy. Also, I think Netter's flashcards are really good for helping to reinforce everything that I learnt during my anatomy sessions. And if you have a look at the picture on the far upper right corner, you can see examples of the Netter's flashcards. And finally, there's a free website called Teach Me Anatomy, and that really nicely summarises all the key concepts from anatomy, and I would often use that website for my pre-reading. Another handy thing about the Teach Me Anatomy website is that it explains and summarises the key principles of anatomy at the top, but when you scroll right to the bottom of the screen, it has these clinical scenarios and the clinical relevance of that anatomy topic, and that's really good because those little clinical scenarios are something that can quite easily crop up in the anatomy OSCEs in the summer. So I just wanted to say thank you for watching my video today. Hopefully you found it helpful. Can I ask you to please like and subscribe to my channel, and also share this video with your friends. Thank you for watching my video, and I wish you all the best for your exams.